Hello and welcome to Ask the Doctor, the video series that highlights the wonderful work of newly graduated researchers and PhD candidates. I'm Matthew Wirdnam and I'm a physiotherapist and graduate researcher here at Trobe University. Our guests on this episode of Ask the Doctor are Dr. Denise Jones and Dr. Joanne Kemp. Prior to completing her PhD, Denise completed a Bachelor of Zoology at the University of Hull, followed by the Bachelor of Physiotherapy at Teesside University. After completing her undergraduate studies, Denise completed her Master of Manipulative and Sports Physiotherapy at the University of South Australia. In 2020, Denise completed her PhD thesis on the topic of physical activity following arthroscopy for hip-related pain. During her time as a PhD student and candidate, Denise was supervised by Professor Kay Crossley, Associate Professor Ilana Ackerman, Dr. Harvey Hart, and Dr. Joanne Kemp. Today, on Ask the Doctor, we are also joined by Denise's primary supervisor, Dr. Joanne Kemp. For those who may be unfamiliar, Dr. Kemp is an APA-titled sports physiotherapist and is a world-leading researcher in the field of hip and groin pain. So, without further delay, Dr. Jones, Dr. Kemp, welcome to Ask the Doctor.
Thanks, Matt.
Thanks, Matt.
So let's jump right in. In young and middle-aged adults who have recently had a hip arthroscopy, is the frequently used sport-specific hip outcome score scale enough to determine the perceived difficulties associated with physical activity?
Well, scales such as this can give us an idea. They can give us an idea of perceptions of physical activity, but the hip outcome score may not be the most appropriate score specifically for this cohort. So other scores such as the HAGOS or the IHOT-33 may be more appropriate scores. But I think we also need to think about the bigger entity of physical activity. So we've got that one bit of people's perception of physical activity, but we know that that doesn't really align with the amount of physical activity people do. So we need to look at both subjective and objective measures.
Amazing. And Jo, do you have anything to add to that?
Yeah, I think what Denise has said is absolutely spot on. And the other thing I think that's really interesting is that even within the patient-reported outcome scores, so the hip outcome score was a score that was developed fairly early on in the piece for looking at hip pain, and it has the two subscales, the sort of activities of daily living subscale and the sport and physical function subscale. But they're really brief and they don't capture the complexities of physical activity. And scores like the HAGOS, which has two subscales related to physical activity, it has the sport subscale and also the physical activity subscale, do go into more detail about how well people perceive they can do physical activity. And then the IHOT-33 is an interesting one in that it doesn't ask so much about how well you can do things, but instead it talks more specifically about how do you feel about how well you can do things. So it actually looks at more at the emotional impact of how well people can do things than even a score like the HAGOS does, which is more a nuts and bolts, how well can you do things. And so the IHOT sport subscale asks questions about how do you feel about whether or not you can do certain sporting activities. So they actually explore different domains. And I think that one thing that then brings up is that we know that whether or not people do activity and whether or not they do sport is impacted by people's psychological state and their emotions. And one of the things that we might be going to talk about a little bit later in this discussion, but one of the really important things that Denise did in her thesis was she had a fabulous paper that was published in AJSM, which is the second highest ranked sport and exercise medicine journal, that where she worked with Kate Webster to develop a a questionnaire that looked at the psychological readiness of people with hip pain to return to sport. And I think that questionnaire is going to add a whole lot of value because it captures that psychological domain about people's readiness to return to physical activity that goes beyond any of the patient-reported outcome measures that we have, but also beyond the objective measures of sport as well that people do. And I think that was a real standout feature of Denise's work, was that she worked really hard to develop and test that the hip return to sport readiness index as well.
Absolutely. Speaking of the complexity of return to physical activity, as clinicians, do we underestimate the complexity of return to physical activity in people with hip-related pain following hip arthroscopy? And how can we reduce the anxiety associated with return to physical activity following hip arthroscopy?
Well, I think in relation to the first part of your question, as clinicians, I think it just is really easy for us to underestimate the personal complexity that people feel in returning to physical activity following, during any kind of rehab, really. Mm-hmm. So whether it's being able to walk to school with the kids or compete in the next marathon, any restrictions in what we can physically do tend to cause a great deal of anxiety. And then the second part of your question is, can we do anything to help that? I think we certainly can. And I think as physios, we're ideally placed to do so. So if we think about some of the findings from the qualitative research we did, one of the key things in there was this sort of mismatch between what people expected to happen and what actually did happen. So people had these false expectations or overestimations really of where they were going to be at 6 months following their surgery. And because they weren't hitting those perceived physical activity milestones, that was something that caused a great deal of anxiety. So I think as physios, we can work with our clients to agree sort of mutually based goals, so we can give people a better understanding of where we expect them to be, and the fact that, normal is quite a wide-ranging concept, and not everybody is going to hit what it says in this paper or that paper and be running at 3 months or whatever. So I think that's the first thing, is just taking time with patients to agree goals and to look at functional goals that are relevant specifically to them, which is something I'm sure we all feel we do, but I think maybe we forget to do it with as much care as we should. And I think, as Jo was saying, the other thing is to consider that there's both the psychological and the physical aspects that are important in returning to physical activity. So as a physio, I'm very used to looking at range of movement, muscle strength, functional tests, etc. But that idea of also needing psychological readiness to return to physical activity is really important. And something simple like the scale that we have is only 5 questions long, but it provides a framework to start those conversations with patients, which I think can sometimes be difficult. From their perspective, they don't want to talk about those sort of emotional cognitive factors, and can be difficult for us to open those conversations. And I think the final thing is we can use objective measures. Something as simple as step count is a nice, easy measure of weight-bearing physical activity. Most people have access to something that can help them with step count, whether it's an app on their phone or whether it's a fitness tracker. And as physios, we can use that to sort of guide rehabilitation goals, but also look for peaks and troughs and reasons why people might not be doing so well, or where they may have done too much, or just are they meeting basic physical activity guidelines, which is something we need to make really important in our clinical practice with patients. Yeah. Sorry, that was a long answer.
I think that was a really good answer. Jo, is there anything that you would like to add to that brilliant answer from Denise?
Not really, Matt. I think Den absolutely nailed it and covered everything really, really well there. And I guess what I would like to do is just reinforce and highlight that we do need to be encouraging our patients to meet the physical activity guidelines. So the WHO physical activity guidelines were updated at the end of last year and published in BJSM, and it's really clear that people should be meeting that 150 minutes of moderate physical activity a week or 75 minutes of vigorous physical activity a week, and be doing some strength-based activities. And sometimes I think as physios, we can get very narrowly focused on the condition that we're treating. So we're treating someone who's had a hip-arthroscopy, but we need to look more broadly at not just their hip, but them as a whole person, and the importance of meeting those physical activity guidelines for their general health and well-being. And there's some work out there that shows that people with hip pain are frightened to exercise and frightened to do activity because they think that it's going to cause more damage to their hips. And I think that applies, Den's work showed that applies in people who have had surgery, that they're worried they're going to undo the work of the surgeon or break the repair or whatever, as well as people who haven't had surgery. And so we need to encourage them and make them feel less scared of doing physical activity because it's such an important thing to do. And so to do that, we have to, as clinicians, start at a really, we have to talk to them about their goals and start at a really easy, safe space for them to be able to do that, and then just do a really graded and incremental building up of their physical activity in a way that they feel safe. And Den's work captured people who were 6 to 12 months post hip arthroscopy, and even at 6 months, when these people all felt that like they should have been better. What Denise found in her outstanding work is that a lot of them were frustrated because they weren't better yet. And so, but we know that that's actually pretty normal. So I know we're going to talk a bit about Den's systematic review, but it is really normal for people to not be better at 6 months. And so we need to set our expectations as clinicians, whether we're the physio or the surgeon or whatever, that it's okay to not be better yet at 6 months, and that you're on this pathway to getting better, and our job is to help them feel safe to continue to try and do, bit by bit, become more and more active in a way that they feel safe.
Jo, what do clinicians and researchers need to be aware of when interpreting Den's research? For example, are all subjective and objective outcomes created equal, and are they appropriate to use in every cohort?
So it's a good question. And I think there's so many different outcomes out there that we have to think about, well, what's the question we're trying to answer with the outcome? So, for example, we know that the self-reported measures of physical activity, people tend to overestimate what they're doing. So if we want a cold, hard, objective measure of how much somebody's doing, probably an objective outcome measure might be better. So using, as Dan said, something that measures their step count. Step count's a really nice, simple way to measure something. So that's probably the outcome to use. But if we're more interested in knowing what people think about their physical activity, or how they believe they're going with their physical activity, or whether they're scared about physical activity, then some of the subjective questionnaires might be better. And, Den's the expert in the different measures of physical activity in this space. So maybe I'll hand over to her and she can perhaps expand on when you might choose to use which of the different outcome measures.
I think, like Jo was saying before, that each of the measures gives us something different to think about, and you could overload patients with lots of different things. So think about what it is that you want to specifically have information on, and it's good to know how people feel about performing their physical activity. So something like the IHOT would be a good measure to use. Things like the Hip Return to Sport Index for psychological readiness is only 5 questions long. It doesn't take long, so that's an easy thing to add to your sort of standardized and systematic collection of information. And also, I mean, if you specifically have elite sports people, you might want to change the type of psychological measures that you use and look for something that's more relevant to that group. But always sort of just keep in mind what those measures are being tested on, who they're being tested on, and whether they're relevant for the patients that you're using them on. So a measure that's relevant for somebody who's just had a hip replacement in their 80s would not be the same measure for somebody who's just had an arthroscopy in their 30s and such like. So.
And Matt, I'll just jump in again on that one, just following up from what Dan said. So Denise was part of there was a HIP consensus meeting where the papers were published last year in BJSM, and Dan played a really prominent part in the consensus statement on which patient-reported outcome measures are most appropriate for people in hip pain. And that I would really like to direct people to have a look at that paper that Denise was second author on. That was first author was Franco Empalaziri from the UTS in Sydney, but that's a really good paper because it goes in, if people are interested in all the detail on the quality of all the outcome measures, so looking, the technicalities, the psychometric properties, that paper's got a lot of detail and really teases out all of the questionnaires related to hip pain, physical activity and other components as well, and how each of the questionnaires stacked up against each other. I think that's something that's also really well worth having a look at, that Denise made a really big contribution to as well.
Thanks, Jo. I'll make sure that I include that in the link below this video. Dan, thank you for your answer. That's really some really common sense advice, and I think it's really good advice to keep clinicians thinking about what it is that they're trying to measure and then what they're going to use as a result of that. Dan, your recently published systematic review on physical activity following hip-arthroscopy concludes that there is a compelling case for higher quality and sufficiently powered observational studies and randomized controlled trials. In your opinion, what does this future research look like?
I think it's very easy for us when we spent 4 years submerged in something thinking it's going to change the world, but we have to remember it's just such a tiny link in that sort of continuum of information to getting to where we need to be. And I think that's really what that statement's about. And to help us get there really links back to the last point, in that we need to have sort of a systematic and standardized collection of information. So again, linking back to what Jo was saying about the consensus meeting and the recommendations that came out of that, both clinicians and researchers need to look at documents such as that so we can start to pull information more. And we haven't got, studies using 250 different outcome measures that, the outcome measures may not be ideal, but at least if we narrow them down, we can start to pull that information. And so I think that's what sort of one of the key things, because big randomized controlled trials are obviously the way forward, but they're really difficult, they're really expensive, and we have to think about ways that we can do smaller things that we can start to pull together. And whether that's sort of looking at databases such as the Danish hip-arthroscopy index, which gives us lots of really rich information that we can look at together, but then it doesn't have a great deal of information yet on physical activity outcomes, and we maybe just need to expand what it is we collect. And if we can include some objective measures in that, that would just be fantastic data to look back on.
Jo, in your opinion, what does the future of this research space look like?
Yeah, I think Dan's right. I think really trying to get clinicians and researchers engaged so that we are collecting standardised information across large registries and large databases, and doing it internationally is really important. So both in people who have had are planning to have hip-arthroscopy surgery, but then, there's a big call now that surgery is expensive and there are risks associated with surgery. So also in non-surgical cohorts. So, whether we can engage physiotherapy clinicians who are treating people with hip pain to start to collect activity on physical activity collect outcomes on physical activity is really would be fantastic. There's a lot of challenges associated with that, but being, as researchers, we really need to engage with clinicians and also engage with patients as well, so that there is that goodwill for us to be able to sort of start to tap into physical activity data. We're involved with the GLAD program at Trobe University, where we've set up a registry, and that a similar registry could provide an opportunity where we can start to collect standardised physical activity measures across different groups of people with hip pain, and that really does help provide a lot of really rich data. But the other thing is that in in the more traditional research projects, ones that are already running or ones that are planned, to put some sort of measure of physical activity into that then allows us to look at whether interventions that we are doing have an impact on physical activity, and also whether certain things are associated with better or worse physical activity, because that helps us develop interventions that are going to improve physical activity. I also think that there's a space for well-designed resources for patients to be able to access. So web pages, blogs, educational material. Education is key with these patients about how physical activity is not just safe to do, but really important to actually improve their joint health. So I think there's a place to put together really good educational resources and then potentially test those resources as well.
Thanks, Jo. Thanks, Den. It's been an absolute pleasure to learn more about your research. Now, is there anything you'd like to add or resources other than the consensus statement that you'd like to direct people towards?
Give me a minute.
Well, look, I guess what I want to say, Matt, is that the work that Den did as her PhD was it was an amazing thesis. She had so many different methodologies across her thesis, where she did, I think, the biggest systematic review that I've ever been part of. She did some really amazing in-depth qualitative work, some fabulous quantitative work where she measured physical activity across different groups of people, those who'd had surgery, those who hadn't, healthy controls. She validated the use of Fitbits in both the laboratory setting and in the free living setting as well, which is really, really important. And she also developed a new patient-reported outcome measure. So the amount of work was huge and really, I think, has changed our perception in how we perceive physical activity. I think that all of the papers, which I know you're going to highlight from Den's thesis, are really worth a read for people who work in the hip pain space. But I would also think that the other consensus papers that Den played a really prominent part in, she was there as our physical activity expert. And she can probably tell you a little bit more about the other consensus papers and what physical activity things, which basically she recommended in the physical measurement paper. Den made recommendations on how we should be measuring physical activity. As I said before, she played a really key role in the recommendations on the patient-reported outcome measures, and in the treatment, what does physio treatment look like? There was a strong recommendation that patients who are having physio treatment with hip pain should be guided towards returning to physical activity and returning to sport. And Dan's expertise in that paper was really was a critical part of those recommendations as well.
We'll make sure that we link to all of Dan's thesis papers and everything that you recommended just then, Jo. Now, Den, is there anything that you would like to direct our viewers to? Any resources that might be of benefit?
I think Jo's probably just about covered it. If I think of anything else, I will drop some resources into you. If anybody has any specific questions, we can pop my email address up, and I'm happy to chat to anybody who wants to talk about the work that we've done. But I think probably the only other thing would be to gather some resources looking at step count and how that relates to different physical activity levels, because we do need to keep coming back to this idea that we need to keep reinforcing physical activity for health, as well as thinking about sort of return to sport and that kind of level of physical activity. Because even within our cohort who were football players, a lot of them didn't reach those sort of levels of physical activity that we'd be expecting. And so we can make presumptions about what people are doing, but I can send you some resources that will help people look at step count and interpret that in terms of amount of physical activity.
That'd be really useful. Thank you. Well, thanks again. And I look forward to hearing from what's next in both of your clinic and research careers. It's been an absolute pleasure to have you on Ask the Doctor today.
Thanks, Matt.
Thank you very much, Matt.